Last year in late 2017, Australia was hit with a deadly flu virus. The virus known as H3N2, a strain of influenza, began to spread in high volumes across the country as the winter season approached. The media has called it the dreaded Aussie Flu, and it is currently wreaking havoc in Australia and its Royal Arms partner the UK. It spread to all but 2 UK cities in a matter of days, putting hospitals under strain and prompting some to prohibit visitors. A number of Northern Ireland churches have even banned handshakes to combat the risk of infection. The flu has already claimed a number of lives in Ireland, Scotland and England. Last year, Australian Authority released a report that documented 745 Australian deaths in laboratory-confirmed cases of influenza, with more than 248,000 confirmed cases. The H3N2 virus, an aggressive and fast-mutating strain of influenza, accounted for more than half of all flu cases across the nation in 2017. Now this virus has found itself across overseas into the United States. The flu epidemic has struck the entire mainland at the same time and in similar levels for the first time ever, as health officials warn the season could get worse. Influenza activity is now widespread in all states except Hawaii, with the deadly virus already claiming the lives of more than 85 adults and 20 children this flu season. The U.S. Centers for Disease Control and Prevention has reported that 2 strains of influenza viruses are being reported across the country, including H3N2 and H1N1. Of the reported cases across the country, mostly everyone is suffering from the H3N2 strain at the moment. But officials have warned that the H1N1 strain is also hitting. Medical officials are saying that we are seeing H1N1, which is the other influenza viruses, starting to show up in states that have already had H3 activity. It emerged that the pharmaceutical company Baxter had created the H3N2 flu viruses. The original virus is totally harmless to ferrets. But after Baxter's experiments, they had contaminated H3N2 with the aggressive and non-declared avian flu virus H5N1. It was originally designed as an experimental flu vaccination in Austria 2009, and when the Austrian and Czech Republic Authority did its final tests on the vaccine before official public release, in their tests with ferrets, it killed more than a dozen. Baxter was heavily fined and penalized for their near catastrophe by EU states and the World Health Organization. What's interesting is that Baxter has been in similar controversy before, when the live AIDS virus was found in their blood products for Asia and Latin America. Nevertheless, this strain of H3N2 has been rapidly spreading around the world.
The mainstream media wants the whole of the West, from mainland Europe, the UK, through to the US, to know that a deadly mutated influenza outbreak is wiping out humanity as we know it in Australia. And what's worse is that it's heading for you in a matter of just weeks. But wait, doesn't the mainstream media talk complete and utter bullshit? Perhaps then it would be good for our sanity to learn in just 3 simple steps the truth about the recent flu outbreak in Australia and get to grips with understanding why it's all just one big hoax. Number 1. Every annual flu scare is a sales pitch to sell and promote the consent for a useless but highly profitable vaccine.
Will launch a probe into pharmaceutical companies accused of manipulating swine flu data. This follows a claim by a renowned German scientist that vaccine manufacturers pressured the World Health Organization into declaring a swine flu pandemic, seeking to increase profits. RT's Laura Emmett has more.
It was supposed to be a deadly pandemic, but it's so far nothing more than a serious cold. And it's left a lasting headache as a debate rages over whether pharmaceutical companies deliberately misled governments about the seriousness of swine flu to make them stockpile vaccines. The legal standards organisation, the Council of Europe, will gather the arguments.
Britain has spent a fortune on preparations. We've caused a great deal of stress to the population. People are very anxious about it. And we've distorted the priorities of our health service. And I believe when we have a thorough investigation and we look at this, we'll discover that that's the story. The world has been subjected to a stunt for their own greedy interests of the pharmaceutical companies.
What lies ahead? Even more. Baxter's ongoing mission to save and sustain lives continues to inspire us to bring more products to more people and to create new ways to transform care for every patient, every time. What began in 1931 stands stronger than ever. Today and every day, for patients and partners around the world, Baxter Hospital products will be there in the moments that matter most.
I was the guest of the Ministry of Health. Please listen. And my sister who was talking, she said, "We are so happy that every child in Zimbabwe has been vaccinated." Every child. You trust your enemy too much. The enemy came to the native people in America, the Indians, and said, in the winter, you all need blankets. We're going to supply blankets. But they put smallpox in the blankets, and when the Indians wrapped themselves in the blankets, they were wiped out.
I never went to a doctor. I never had a vaccination. We never had medicine growing up.
Because I'm about to have my first ever flu shot, and I thought I couldn't get a better guy than you to do it.
1, 2, 3.
Oh!
And
at times like these, you might ask yourself, how did I get here?
Baseball, basketball, tennis, Jordan McFarland is an avid athlete. But a week ago, something stopped him in his tracks. Thursday afternoon, he got his flu shots. By 10 o'clock Friday morning, he had chills and started feeling weak. And by 4 that afternoon, he was having spasms.
It's flu season. And at our age, flu can be more serious. Nobody has time for that.
it would be dishonest to say that we know for sure the vaccine is going to be safe for everybody. You give a vaccine to a couple 100 million people, there are going to be problems.
Charlie was given the flu jab at 4 p.m. on Friday, the 23rd of September 2011. Hours later, he went to sleep and has been predominantly asleep ever since.
Maybe you didn't know, people with the flu can spread it up to 6 feet away.
You can tell things are deteriorating. Is there any advice you can give me?
Don't ever take a flu shot again.
But as we age, our immune system can weaken, and traditional flu shots may not work as well for us.
I love to sew and crochet. I can't do that now. I can't even read. That flu shot did me in.
By shielding yourself with a flu shot at Rite Aid, where one simple stop can protect you from this season's strains of flu.
I have more concern about the vaccine than I do about the swine flu. It's been rushed to market. There are high levels of adjuncts which basically make it more potent.
Fluzone High Dose is a flu vaccine designed specifically for patients aged 65 and older. This vaccine helps older patients develop better immune responses.
A total of 23 deaths were reported during the day 29 through 180 post-vaccination. 16 among Fluzone High Dose recipients and 7 among Fluzone recipients. So the high dose is definitely killing twice as many seniors.
Designed for adults 65 and older. Unlike other flu shots, Fluad contains an immune-enhancing ingredient that can help provide a strong immune response to the flu.
Sure, the numbers are pretty good. At best, about 60% of people who get the shot will dodge the flu. At worst, only 10% will be protected.
I'm going to get it, if that helps at all, but I'll tell you, my wife is not going to immunize our kids. Because I've got 4 of them, and when I go home, I'm not Dr. Oz, I'm Mr. Oz.
Get your flu shot at Rite Aid today.
It has been the object of this diabolic plan is to frighten people into getting vaccinated, or even worse, to declare mandatory vaccinations for everyone in order to infect them with many different diseases that will be included purposely in the swine flu vaccine. A family in North Texas said a popular flu vaccination left their 6-year-old daughter with bizarre and possibly life-threatening side effects. The family asked their local physician to write a prescription for Tamiflu, an antiviral medication designed to treat individuals with the flu, shortly after administering the treatment. However, the family from Allen, Texas, said that their daughter began exhibiting alarming side effects, including hallucinations and an attempt to hurt herself. Her father said the second-story window was open, which is in her bedroom, and she used her desk to climb up onto it, and she was about to jump out the window when my wife came up and grabbed her